Right now, as we adjust to the safer at home order, just as health leaders expected, we're starting to see an increase in cases in certain areas. In fact, coronavirus cases in Franklin County have nearly tripled in the past week alone.
Joining us now via Zoom from the Alabama Department of Public Health is Dr. Karen Landers. Good morning, Dr. Landers.
Hello, how are you?
Doing well. Thank you so much for waking up with us this morning. You know, we saw that significant jump in cases in Franklin County. A lot of people are wondering, why are we seeing that jump? Is it delayed reporting? Is this something that may have happened over the weekend in real time?
Well, actually, last week in Franklin County, we increased testing so that there were several entities that came on board to do testing. In addition to that, we had some cases that we followed up in terms of persons who had symptomatology that lived in the house or were close contacts to cases. So as a result of that, we tested additional persons that were epi-linked to the original cases. And then finally, we did some more community outreach in Franklin County to ensure that populations had the knowledge they needed about the virus.
So in this case, it's proving that that contact tracing and that kind of investigation really is working to pinpoint those cases of coronavirus.
Yes, contact tracing is a vital part of what we do in public health. And again, a lot of this rise was related to contact tracing.
Dr. Landers, real quickly, should we be worried about that increase in numbers in Franklin County?
Well, I think anytime we see an increase, we have to have concern. But I think the most important message is that we continue to do the things that we know have influence on this, such as the safer at home order, the respiratory hygiene, certainly 6 feet apart, and finally, just continuing to be aware of the risk of the virus.
Dr. Landers, making news this morning, the FDA, as you know, has approved this first coronavirus antibody test to tell if people have been infected of the virus or have recovered from it. Any idea if Alabama plans to use that kind of test?
Well, as far as the state health department, we won't be using it right away. We are following this very closely and looking what the Infectious Disease Society of America is saying about antibody testing. So we will be following this, and we do expect that antibody testing will be useful at some point. However, there's still a lot of data that needs to be gathered.
All right, we have just a few quick seconds left. Dr. Landers, if you could give a letter grade really quickly for how we're doing right here in North Alabama with the Safer at Home order, what is your grade for North Alabama?
Well, I think that's really a difficult question. One-on-one with persons, I have been very impressed that people have wanted to do the right thing, that they have wanted to protect their families and themselves. So I think my answer would be is that people are doing the best they can, seeking information, and trying to comply with everything they've been asked to do.
All right, Dr. Karen Landers with the Alabama Department of Health, thank you so much for your time this morning.
Absolutely. Thank you.
Thank you, Dr. Landers. 6:26 right now.